The story begins not with one, it begins with a country. Across the villages of India, millions live with everyday health crises, shaped by distance, limited access, and scarce medical support. The demand for care far exceeds what the present healthcare system can manage, leaving many still unseen. Additionally, capability gaps across the public health ecosystem constrain doctors' abilities to deliver timely and high-quality care. Tata Group has implemented multiple healthcare initiatives spanning primary, tertiary, and cancer care for more than 10 million patients over a decade, and studied each element of the public healthcare system. Through this, they have conceptualized the Tata Digital Nerve Center that expands both capacity and capability at the local level. And so emerges a new guardian, Tata DINC.AI. With this support, the public healthcare ecosystem can be strengthened to deliver high-quality and timely care even in the most remote corners. It understands each person deeply and brings care right to where they are, most times near their home and at times directly at home. From millions to one. Meet Ramesh. Ramesh is a farmer in his 50s. For a year, he hasn't felt well. High BP, high sugar, and recent swelling in his feet. Ramesh calls DINC.AI. It does not feel like a machine. It listens, it asks and understands.
नमस्ते रमेश, मैं आपकी कैसे मदद कर सकती हूँ?
जी नमस्ते, मैं अच्छा महसूस नहीं कर रहा हूँ।
DINC.AI is trained for tens of thousands of primary and chronic care cases, capturing clinical reasoning across these patients' longitudinal journeys over a span of 2 to 10 years. It has distilled reasoning patterns of 100 plus clinicians and is anchored on national and international medical guidelines. This clinical intelligence is embedded in the DINC.AI's master care planogram engine that is used for generating personalized treatment plans for every patient, such as for Ramesh. DINC.AI asks to see Ramesh's feet through a video call to record and assess the situation, drawing knowledge from its clinical repository. It maps Ramesh's symptoms, visual findings, and biomarker patterns against validated trajectories. From Ramesh's past medical history, records, his current symptoms, and clinical findings of bilateral pitting pedal edema with normal heart and lung sounds. DINC.AI uses its detailed contextual clinical knowledge to explain everything clearly and calmly to Ramesh, guiding him through his provisional diagnosis and the immediate steps he needs to take. DINC.AI matches Ramesh's prolonged raised HbA1c levels against a repository of similarly treated cases and concludes that his present condition is due to microvascular kidney damage, resulting in protein leakage and fluid retention in his legs. DINC.AI arrives at a probable disease process specific to Ramesh's risk profile and advises investigation to confirm the predicted diagnosis. DINC.AI organizes his tests at home, taking the burden off Ramesh. A community health officer soon visits with a portable diagnostic kit. Through a single prick point of care testing, the officer checks over 25 biochemical parameters, including his renal and protein levels. No paperwork. His results sync instantly into the DINC.AI, which generates a clinical interpretation report for the physician. Integrated, seamless. While most treatment and care can be delivered virtually, including a virtual consultation, DINC.AI identifies the need for a physical assessment for Ramesh at the PHC and parallelly schedules a virtual consult with a specialist who is located remotely. DINC.AI prepares a clinical summary and shares it with both the PHC doctor and the specialist well before the consultation so that they are well prepared. Here, care does not end solely as a prescription. It adapts. The PHC doctor explains to Ramesh that his condition needs continuous care and management. DINC.AI combines Ramesh's clinical specificities with its master care planogram engine to generate a comprehensive treatment plan to manage his type 2 diabetes, mellitus, hypertension, and early diabetic kidney disease. Ramesh's personalized care planogram maps his medication and monitoring and includes lifestyle guidance for 24 months with an immediate focus on the first 90 days. DINC.AI also generates a personalized wellness score for Ramesh to help monitor his clinical and wellness progress. DINC.AI proactively reaches out to Ramesh and advises him to alter his diet by reducing rice and salt intake while increasing his vegetable consumption. It also advises him on strength conditioning exercises and measured water intake. It nudges him to ensure he adheres to his medication and overall care planogram. Over time, Ramesh feels better and more active. His swelling reduces, his BP and sugar stabilize. This DINC.AI's clinical intelligence ensures continuous and consistent high-quality care. And through this consistency, healthcare becomes something different, not distant, but delivered. By unifying patients, doctors, and real-time clinical intelligence into one continuous pathway, DINC.AI safely guides millions of care seekers like Ramesh. Patient-centric holistic care, shaped by continuity, connected by intelligence, and delivered proactively closer to the patient. This is DINC.AI.